I'd like to thank you all for joining me in this video, and I'd like to thank 1 in 5 for um, giving me the invitation, and also Cincinnati Children's Hospital Medical Center for the 24 years of employment I've had. The topic we wanted to cover is kind of the effects of trauma and how it can affect a whole system, such as a school, and also something called compassion fatigue, and what are some of the things that you can do about both of those things. First of all, kind of an operational definition, there are systems of care or systems of education that can very much be affected because there's close-knit relationships in that system. So if there is somebody in the system who's been hurt or traumatized, the effect on the people around them can be quite profound. Some of the theoretical models talk about kind of a bullseye target or a laminated onion as to, the people closest to the individual or the event in either geographic proximity or idealizing the person or having a connection through their family, whatever, they tend to feel the impact the strongest. So for instance, if a teacher or a student were hurt, or let's say had COVID, but had a difficult time with it, the other children in that classroom would be very much affected. Friends to the child or the teacher would be affected. Family, obviously. People who are engaged in similar activities, if they belong to the same clubs or sports teams, they tend to be more impacted. And even children who aspire, let's say the person who is ill or been traumatized, if that person were somebody that maybe other children looked up to, that they would be affected by the trauma might more easily affect them. So in a way, affiliation or closeness, identification, friendship, it creates a vulnerability, but it also can create a protective effect. Now, before I get to that, let me also say that the children or teaching staff who might already be challenged or taxed by their life, their personal life, or events in the school or social life, they're already maybe, right above slipping into, say, a clinical situation, be that anxiety, depression, post-traumatic stress. And if, let's say, there's domestic violence in their home, or the parents are going through a divorce, or a person's already struggling with mental illness or brain health and or substance use disorder, the trauma itself can act as an undertow and take somebody who's already on the margin and pull them into a state of decompensation. Often when we work with systems through the National Center for School Crisis and Bereavement or my referrals through Children's with systems, we look at how they can become more resilient. And there's a lot of programs that are specific to helping kids with the after effects of suicide in the schools. So these are systems that are, often described as postvention, but they also involve the same principles that are prevention. So even if there's not been an acute event, working on the support system for the kids and the staff to help them better cope and feel connected can have a very positive effect on their resiliency. This could be special meetings. We've seen some schools bring in mindfulness into the school. The Cincinnati community throughout the public schools has been affiliated with MindPeace, which is an outstanding organization that has brought therapists into the school for kids. And most schools have a relationship with an employee assistance program. And so the EAP can be a place to get initial support and sometimes referral to more long-term support. So those are all important aspects of the structure. The other thing is that all of us, when we eat a nutritious diet, when we exercise, when we take our vitamins, when we take advantage of our affiliation with our families and our friends, those supports can do a lot to help us regenerate and be able to go back into an environment that can be stressful just because of significant chronic stress. I might mention, should a person struggle with a clinical level of challenge, be it anxiety or depression, even if it approaches a person having some self-destructive or destructive thoughts, we have excellent treatment paradigms Some involve psychotherapy, some involve medication. Often we use those together. The overall success rate when we combine those therapies is approaching 80%. And even when the first intervention is not successful, a second intervention, a different medication or a different form of psychotherapy, again, will have an 80% chance of helping the individual. So it's really quite hopeful what we have to help people through these types of challenges. So I do thank you for allowing me to share some time with you. I hope the noises were balanced and you could still hear my voice. And I hope you all have an excellent spring. And I wish you, your colleagues, your families the very best in what is yet to come. Thank you.